College of Nursing is worried that Brexit could affect recruitment. Listening to that is Maria Caulfield, the MP for Lewis, who is herself a former nurse. Maria, thank you for joining us on the programme this evening.
Good evening.
Now, when we've left the EU, will there be a special dispensation for health workers from the EU?
Yeah, I'm also on the Brexit Select Committee, and this is one of the areas that we are looking at, because one of the problems we have with the current immigration system is that there's free movement of people from within the EU, but if we want to, it's very difficult to recruit nurses, say, from the Philippines, or doctors from India, or doctors or nurses from places like Australia and New Zealand. And what we really need is a robust global immigration system. So areas like nurses and doctors, where we do have a shortage of, people can come and work here very easily. And at the moment, that isn't the case for countries outside the EU. So it does put pressure on places like the NHS, which are so reliant on many overseas workers.
Why are we so reliant? How concerned are you by the need to keep hiring from abroad?
Well, that's one of the things that the controversial student nurse bursary was trying to address, because currently there is a cap on nurse training places because there's a set number of places that the bursary pays for. And by scrapping the bursary, the government are taking a gamble. I don't necessarily agree with this, but the government are taking a gamble that there's over 100,000 people that they turn away each year for nurse training because of the set number of places. That if the student nurse bursary goes and people are paying tuition fees, that there will be more nurses coming into the system. I'm not so sure that will work. But the cap on nurse placements has meant that there's only a certain number of UK nurses coming into the system every year, and that's why historically we've been so dependent on overseas workers. Again, initiatives like the apprentice nurse, where people are working and learning on the job, will help boost UK nursing numbers, as will the associate nurse, which will help upskill healthcare assistants to just under nursing levels. But, as it stands right now, we are dependent on overseas nurses, and that's why it's important that we get the new immigration system working well for the NHS.
You don't sound convinced, Maria. Isn't there a real potential that nurses could be put off by the tuition fees?
No, absolutely, and I argued that very strongly. I went through the bursary system myself, and if I'd had to pay tuition fees, I'm not sure I would have gone through nursing. I've made that very, very clear. But with the new schemes that have come through since I made those arguments, like the apprentice nurse, nurses are learning, but also being paid for the work they do in their hospital trust. And there's not a huge number of apprentice nurse places yet. It's still very in the early stages. But if that sort of scheme was rolled out, I think you would see a surge in UK nursing numbers. But I'm not sure that scrapping the bursary and going through the traditional university route will do that.
What about the uncertainty around Brexit at the moment? The Royal College of Nursing is worried that it might be harder to either hire or retain staff from the EU at the moment.
I'm not sure that will be the case, and certainly the work we're doing on the Brexit Select Committee, looking at what the new immigration policy will look like, we have very much made it clear that firstly, there's an argument for exempting students out of immigration numbers for students from doing all courses and from all places across the world, but also for areas where we are so short of staff, and the NHS being one of them, that you do need to have a much more flexible system. So it shouldn't be a one-size-fits-all. Those skills that we're short of, we need to welcome with open arms from wherever they are in the world, whether they're from the EU or whether they're from the Commonwealth or from other parts of the world. So that is something that's being looked at quite urgently now as we're moving forward with Brexit.
Maria, thank you for joining us on the programme. Lewis MP Maria Caulfield speaking there. Well,